Hello, my name's Rianne Paul and I'm a community heart nurse for City Care. This presentation is about cardiovascular disease. The topics that we will cover are how the heart works, types of cardiovascular disease and causes, interventions, and what you can do to prevent cardiovascular disease. Your heart is a muscle and it's roughly the size of your fist. It's located in the left side of your chest, and it acts as the body's pump to push oxygen and nutrients to all parts of the body to help organs and muscles function. It works alongside your kidneys to regulate blood pressure. There's some great videos on the British Heart Foundation website, and this can show you exactly how this organ works. Cardiovascular disease is an umbrella term for conditions that narrow or block blood vessels, also known as coronary heart disease. This can lead to a heart attack, stroke, or angina. Some of the risk factors of cardiovascular disease include smoking, stress, high intake of alcohol, high blood pressure, high cholesterol levels, being physically inactive, being overweight, and conditions such as diabetes. Other factors include family history, ethnic background, sex, and age. All these risk factors can lead to a plaque buildup, also known as fatty deposits or atheroma, and increase the risk of blood clots. The picture here shows plaque buildup and narrowing of the coronary artery. We will now discuss in more depth the different types of cardiovascular diseases and the most common symptoms. Angina is a symptom of coronary heart disease caused by narrowing of the arteries that supply the heart muscle with blood and oxygen by plaque. Sufferers of angina will usually experience pain and discomfort to their chest, which will usually happen on exertion. They may also feel pain to their arm, neck, stomach, and jaw, and have symptoms of shortness of breath and fatigue. It is your body's way of telling you that your heart is not getting enough oxygen. If you experience angina and have a GTN spray, you can use this by taking 2 sprays under the tongue while sitting down. Wait 5 minutes, and if the symptoms have not improved, you can take another 2 sprays under the tongue. After a further 5 minutes, if the symptoms persist, you must call 999, and whilst waiting for an ambulance, you can use your GTN spray a 3rd time. Always ensure that you carry your GTN spray. A myocardial infarction, heart attack, happens when a piece of plaque breaks off and a blood clot forms around in order to attempt to repair the damage to the artery wall. The clot can block your coronary artery and cause either a partial blockage or a total blockage, causing your heart muscle to be starved of oxygen. The symptoms include pain or discomfort to your chest, which may radiate to your arms or jaw, feeling of nausea, sweating, dizziness, or shortness of breath. If you feel you're having a heart attack, you should call 999. The difference between angina and myocardial infarction is that angina is caused by reduced blood flow, and an MI is when the blood supply is blocked off from the heart. Strokes and TIA. A stroke happens when the blood flow to the brain is interrupted, causing brain cells to be damaged because they aren't getting enough oxygen. A TIA is also known as a mini-stroke, and it happens when there's a short temporary interruption to the brain. Both can cause similar symptoms, such as weakness in the arms, face falling to one side, pain in the chest, or slow speech. The acronym FAST helps us to remember these symptoms and act accordingly. Face, arms, speech, time. Facial symptoms include drooping of the face to one side, inability to smile, or drooping to the mouth or eye. Symptoms include weakness to the arms, and speech may be slurred or garbled, or the person may not be able to talk at all, despite appearing to be awake. If you recognise any of these symptoms, it's time to dial 999 immediately. It's important for everyone to be aware of these signs and symptoms. So let's look at some of the causes of cardiovascular disease in a bit more detail. Smoking damages the artery lining, which causes the atheroma, and carbon monoxide found in cigarettes reduces the amount of oxygen that the blood can carry to the heart and body. There are support services in Nottingham, such as Stubbit, who can help to provide counselling alongside nicotine replacement therapy. High blood glucose levels from diabetes can damage your blood vessels and the nerves that control your heart and blood vessels. Over time, this damage can lead to heart disease. People with diabetes tend to develop heart disease at a younger age than people without. A diet high in saturated fats and trans fats causes cholesterol to build up in your arteries. High salt diets increase blood pressure, which increases your risk of cardiovascular disease. And eating too much sugar can lead to weight gain, putting you again at increased of cardiovascular disease as well as type 2 diabetes. If you have a family history of heart disease, you may have a higher risk of developing conditions that lead to a heart attack or stroke. Some conditions can run in the family, and this can be due to a combination of your genes and the habits that you share with your family, such as your diet or smoking. The cardiovascular system is affected by alcohol. At the time of drinking, alcohol can cause a temporary increase to heart rate and blood pressure. In the long term, drinking above the guidelines can lead to ongoing heart rate, high blood pressure, weakened heart muscle, and irregular heart rate. Being inactive can lead to fatty material building up in your arteries. By becoming more active, you can reduce your blood pressure, reduce your stress, cholesterol levels, and help to control diabetes or reduce your risk of diabetes and help you to maintain a healthy weight. When you're admitted to A&E with a cardiac event or a TIA, you will usually have various tests to make a diagnosis in order to determine what treatment and plan of care should be carried out. You may have blood tests, an ECG, an echocardiogram, or a cardiac MRI scan. An electrocardiogram is a test which measures the electrical activity of your heart to show whether or not it is working normally. It is not an invasive investigation and can also be done within the community. Cardiac MRI, magnetic resonance imaging, is a way of creating detailed images of your internal organs, such as your heart and blood vessels. An echocardiogram, also known as an echo, is a scan used to look at the heart and nearby blood vessels. It's a type of ultrasound scan and is carried out on the chest. Following these investigations, you may go on to have a coronary angiogram, an angioplasty. This is when a catheter is inserted into your artery via your groin or wrist to look at the arteries and find out where and how much is blocked. They can then treat this by performing percutaneous coronary intervention, whereby the blockage is removed and usually stents can be fitted. A coronary artery bypass graft is a surgical procedure by which vessels are taken, usually from the chest, leg or arm, and attached to the coronary artery above and below the narrowing of the blocked area. Blood is then diverted around the area so it can flow freely to supply the heart with the oxygen it needs to function. There are 4 heart valves in the heart which ensure blood flows through the heart in the right direction. Sometimes due to valve disease or damage, the valves don't work effectively, and this in turn affects the blood flow, and in some cases replacement of the valve is required. Artificial or animal valves can be used. Valve repair is also sometimes an option, and in other cases, a transcatheter aortic valve implantation, also known as a TAVI, can also be performed if you are not well enough for surgery. Heart failure means your heart isn't pumping blood around the body as well as it should. It doesn't mean that your heart has stopped working. It just means that you need a little extra support to help it work better. Symptoms of heart failure include shortness of breath when active or at rest because you're not getting enough oxygen, swelling to the feet, ankles, stomach or lower back caused by fluid buildup, and feelings of tiredness or weakness because your muscles are not getting enough oxygen. Devices are sometimes used. An ICD is a small device which can treat people with potentially dangerous abnormal heart rhythms. The heart contracts by using electrical rhythms. The ICD works by monitoring electrical activity in the heart. If it detects a dangerous heart rhythm, it will monitor and try to pace the heart to avoid a shock. If necessary, the inbuilt defibrillator will shock the heart and restore natural rhythm. This will not happen with normal exercise or exertion. A permanent pacemaker is a small electrical device. It is fitted in the chest or abdomen and is used to treat people with abnormal heart rhythms, arrhythmias, that can cause your heart to either beat too slowly or miss beats. Some pacemakers can also help the chambers of your heartbeat in time. Some people with devices have a monitoring box fitted at home so their device can be remotely monitored by the pacemaker clinic. If you have any questions about any of the topics covered in this session, please contact your nurse or the primary care cardiac service on the number on this slide. Thank you.